My name is Nafisa, and my background and passion is in public health and responding to public health through a health equity and intersectional lens. Before I begin, I would like to acknowledge the traditional owners on the land on which we're meeting on today and pay my respects to the elders past, present and future, and any Indigenous people present today. I'll also like to acknowledge all of you, all my colleagues. I recognize some faces. It's lovely to see you all again. And I'll also like to acknowledge Professor Jane Tomnay, Director of CERSH, the University of Melbourne. And thank you for extending a warm welcome. So obviously, Kelly is saddened she couldn't be here, but she has entrusted me to give you all a very warm welcome. It's terrific to be here this morning representing the Department of Health to talk to you all about the SexRurality Conference. We have finally made it back here despite weather events and pandemic. I would like to thank the organisers, CERSH, for their kind invitation. It's great to see so many wonderful people, particularly those working in regional and rural Victoria. I don't think anybody here today underestimates the public health and personal impact of sexual and reproductive health and viral hepatitis conditions, especially for priority communities. The last few years have been challenging, to say the least, with the COVID-19 pandemic. They've also accelerated innovation, adaptation, and public health system reform that we can leverage and capitalize on, particularly the establishment of the 9 local public health units, local models of care and response, and use of telehealth and digital health. This has really transformed our public health system. We have increasing demand for sexual and reproductive health, prevention, testing and treatment across Victoria. This is driven by changing sexual and reproductive health needs across the life course, the rising of STIs and BBVs, and let's not forget monkeypox. Whilst not an STI, it has had an enormous impact on some of our communities in Victoria. Without a doubt, there have been service access gaps across geographical areas and population groups. The Women's Health Atlas and the Viral Hepatitis Mapping Project clearly highlights geographic areas of need of treatment and service provision. We have a spotlight on women's health, both at a state level and a national level. We know that the pandemic has a strong influence on disease reduction with lockdowns and restrictions in sexual, which has impacted sexual and reproductive health and people's activities and movement to seek sexual and reproductive health. Other influences driving change include population growth, travel, now that borders have reopened, the rising cost of healthcare, and the crisis of bulk billing in primary care, which unfortunately has driven some people to the emergency department for their immediate health needs. And importantly, experiences of stigma, discrimination and racism or shame related to bloodborne viruses and STIs or reproductive health, or the fear of being treated differently still compromises people's experiences to seek care. These present challenges for our healthcare system, communities and individuals. Requiring strengthened public health response, we also need to be aware and cognizant of the unique and rural and regional service access challenges, including geographical distance, cost, confidentiality, workforce attraction and retention beyond the metropolitan area. Improving sexual and reproductive healthcare and viral hepatitis outcomes requires us to address health inequities and take an intersectional approach to meeting people's needs. We know that early detection and management of BBV and STIs can prevent poor chronic conditions and reproductive health outcomes, especially for our priority communities, including Victorians who live in rural and regional Victoria. Victoria's public health vision is that Victorians are the healthiest people on earth. And the new Victorian Sexual and Reproductive Health and Viral Hepatitis Strategy 2022-30 and its plans, launched late last year, aim to support all Victorians to achieve optimal sexual and reproductive health and viral hepatitis health and well-being, and to reduce the impact of BBV and STIs. The strategy was informed by an extensive consultation with the public, the sexual and reproductive health and viral hepatitis sector, and across government, with over 500 people participated in statewide consultations. I'm aware many of you in this room today were part of that consultation, so thank you. Thank you for your honest feedback on what's working and what's not working. And thank you for championing us to be bold, to recognise the shared priorities and actions across sexual and reproductive health and viral hepatitis. This is the first time that reproductive health and sexual health and viral hepatitis have come under one framework, one umbrella. Our new integrated sexual and reproductive health and viral hepatitis strategy recognises the intersections between our approaches, our community, and our system delivery. It's often the same workforce and services that deliver care for people. However, our disease responses to date have often been siloed. We now have 7 plans. 6 of these are tailored to specific diseases or conditions, and we also have a system enabler plan. The strategy overview and system enabler plan frame our approach and details guiding our principles, our priority settings and populations. Given the Victorian Government's commitment to self-determination, this is the first time ever the Victorian sexual health policy environment has explicitly considered the enduring effects of colonisation and racism on our First Nations people. The inclusion of the first ever Aboriginal sexual and reproductive health plan, developed in partnership with Victorian First Nations people, reflects commitment and the importance of improving the health, well-being and safety of our First Nations Victorians. Our approach builds on the Victorian Government's commitment and recognises that partnerships is required between community, government, researchers, clinicians to develop a tailored, holistic and localised solutions to improve people's health and well-being. An inclusive and intersectional approach enables us to respond to the needs of our priority communities. This recognises that not everyone has the same access to healthcare, and some people may experience additional barriers to service delivery. Next slide. The strategy sets out bold and achievable targets. Without system strengthening and scaling up prevention, treatment and care, our elimination targets will not be achieved and will not be achieved without you. The Victorian Government will undertake a midpoint review of this strategy in 2025 to 26 to assess our progress towards achieving our targets. The process will also be used to refresh and refocus priority areas and activities outlined in the strategy and plans. We are currently developing indicators and monitoring framework to monitor our progress, and we'll be developing data dashboards and annual reports which will report on our implementation strategy. So where do the opportunities lie to improve sexual and reproductive health and viral hepatitis? And how do we go about setting this out? Well, firstly, we acknowledge that change takes time and can be achieved by being ambitious and bold and listening and reflecting and learning from our challenges and our successes. System reform can take some time. Equitable access to sexual and reproductive health and viral hepatitis services requires a focus on strengthening workforce capacity and fostering collaboration and partnerships across our healthcare system. The 2022 to 23 state budget outcomes allocated $3.4 million over 12 months to address health inequities by commencing building the Victorian sexual and reproductive health system. This funding was supported and strengthened access to testing, treatment and care by uplifting clinical services, delivering care through primary care sentinel practices and the women's sexual and reproductive health hubs. Piloting the local public health unit's sexual and reproductive health and viral hepatitis programs, and enhancing Victorians' public health response to the syphilis pandemic. To date, we have 11 women's sexual and reproductive health, increasing access to information, clinical services for contraception, termination of pregnancy, and sexual health in the community, which I recognise some of you in this room. These services are supported by the Royal Women's Hospital Clinical Champions Project to ensure women have better access to sexual and reproductive health. There is also 6 primary care sentinel practices to increase sexual and reproductive health testing and care, which is supported by the Melbourne Sexual Health Centre as a partner sentinel specialist site. There are also 4 local public health units, 2 in Metro, 2 in regional Victoria, piloting prevention and workforce capacity, which is to coordinate sexual and reproductive health and viral hepatitis care delivery within their catchments. This is a non-clinical role. Its aim is to engage and improve sexual and reproductive health and viral hepatitis awareness, community engagement, workforce, and outreach in their catchment. And I'll be happy to have a chat if anyone's interested in finding out a little bit more information about some of these. We've also developed the Victorian Syphilis Enhanced Case Management Database to enhance surveillance data information, informing clinical public health management, as well as the Victorian Syphilis Action Plan. Decriminalisation of sex work, which has been invested $3 million over 2 years, allocated in the 2022-23 state budget for public health initiatives to support sex work decriminalisation. This is funded through FIXEN, a peer-led sex worker agency to deliver and expand services and community support. Population health catchment planning. Some of you might have already heard this through your local public health units, but all local public health units are required to develop a population health catchment plan by the end of June this year. LPHUs must target 2 population health priorities, and improving sexual and reproductive health is a possible priority. Response to the Victorian Auditor General's Office report. Some of you might already be aware that there was a recently released report supporting sexual and reproductive health. The audit found that there are areas of need in Victoria where women cannot readily access SRH services, and has made 3 critical recommendations which the department has accepted, including to undertake a comprehensive SRH service demand and analysis for the whole of Victoria, which I'm really excited about, to develop relevant outcome and performance measures for 1-800 My Options and the SRH hubs, to work with the department funded agencies to confirm and implement performance, monitoring and reporting requirements. Communicable diseases and integration to local public health units. This project is driven the integration of community disease investigation and response related to notifiable conditions. So prior COVID-19, these were done in central office. However, after the establishment of the 9 LPHUs, this is now done locally. Since July 2022, notifiable conditions have been integrated on a condition-by-condition basis, delivering 32 conditions over the time frame, including hepatitis B, hepatitis C, chlamydia, gonorrhea, and syphilis. New Women's Health State Budget, which has been, I'm sure you've seen all over the news this week, has been really interesting and pleased to see some of the announcements that have come through. The 2023-24 state budget allocated over $153 million to improve women's sexual and reproductive health. This includes 10 million to implement sexual and reproductive health system strengthening and expansion, specifically to establish 9 additional SRH hubs, and to continue funding for LPHUs and primary care sentinel practices. And this is aimed to provide free to low cost to women, gender diverse and girls who are accessing SRH services. Work is now underway to implement these commitments and identify how these intersect with the broader women's health commitment, such as the 20 new women's health clinics, a dedicated for the first time Aboriginal health-led clinic, and a women's mobile clinic. Ensuring women in regional and rural Victoria can access these services they need, when they need it, where they need it, is a key priority for the government. And finally, to support rising sexual and reproductive health awareness and increasing access to testing, I'm delighted to highlight 2 projects that CERSH are leading at the moment to increase sexual and reproductive health needs, including the STI vending machine. CERSH has developed an STI testing vending machine pilot to improve access to STI testing in rural Victoria. And be proud of your choices. In 2022, CERSH, the Shout Out Working Party, I love the name by the way, and 1-800 My Options, targeted young people living in regional and rural Victoria, and the relaunch of Be Proud of Your Choice will begin again and call on rural young people to inform the campaign design, themes, content and messages. I commend Professor Jane Tomney and her team at CERSH and the University of Melbourne for these innovative and localised solutions. So as you would have heard, and you're experts in the ground and working across Victoria and the states, you know that we cannot do this work alone. And we will be working in partnership with all of you to ensure that this important system reform will meet the needs of our rural and regional communities. You know your communities well and better than us, or better than me at least. And so workforce and working in partnership is a critical component. I hope that over the next 2 days, you have the opportunity to explore the complexities of sexual and reproductive health in rural and regional Victoria from both a professional and a personal level, and work together to share learnings to improve access to care to better meet the needs of people. The department looks forward to working with all of you in partnership to ensure we provide access, inclusive and high quality sexual and reproductive health and viral hepatitis care for all Victorians, no matter where they live or what their challenges are. Thank you once again for your time and for listening, and I look forward to connecting with some of you in the next 2 days. Thank you.